Constipation. Someone somewhere near you is putting an extra effort to get their morning deeds done. In fact, 22% of Indian adults suffer from constipation at some point. But what does constipation mean? Let's find out. In the past 6 months, if your frequency of going to the bathroom is less than 3 times a week, you might be suffering from chronic constipation. If you are experiencing infrequent or incomplete bowel movements or have to put a lot of strain to pass the stool, you might be constipated. It usually takes 12 to 24 hours for our food to get digested and exit our body. But sometimes the food moves very slowly through the colon, resulting in overabsorption of water from it. This makes the stool hard, dry, and very difficult to pass, causing pain and discomfort. Normally, constipation resolves by itself without any treatment, but severe constipation can lead to conditions like rectal bleeding and prolapse. Types of chronic constipation: Irritable Bowel Syndrome 40 to 50%, Obstructed Defecation Syndrome 45%, Slow Transit 1 to 2%, others 4 to 5%. As the slow transit constipation is rare, we will not get into its investigation and treatment of the same. Let's understand IBS, Irritable Bowel Syndrome. Symptoms: urge to pass stools after meals, a lot of gas, bloating, soft stools or mucus in stools, increased frequency of passing stools. Investigation: colonoscopy. Doctor uses a small, flexible tube to examine the entire length of the colon. Treatment: medication like laxatives. The doctors will develop an effective treatment plan upon learning your condition. Yoga. Yoga can help you shut down stress by calming the nervous system and, in the process, calm your irritated digestive system and restore normal motility of the gut. Colon hydrotherapy. The muscles of the bowel are exercised, resulting in the strengthening as well as cleansing. ODS, Obstructed Defecation Syndrome. Symptoms: extensive straining while passing stools, hard stools, dependency on laxatives, use of enema needed, digitation to remove stools. Causes of ODS: rectocele or intussusception. In 60 to 70% cases, a pouch is formed where the feces get obstructed. Pelvic floor dyssynergia. In 30 to 40% cases, there is paradoxical contraction of the muscles instead of relaxation. Investigation: dynamic defecography. Dynamic defecography is done to diagnose rectal pouch and intussusception. Anorectal manometry. Anorectal manometry is done to study contraction and relaxation of pelvic floor muscles so as to diagnose pelvic floor dyssynergia. Treatment: biofeedback therapy. This is done in case of pelvic floor dyssynergia. In this therapy, the patient is taught to relax the pelvic muscles to regain its natural functions. If there is a rectal pouch or intussusception, STARR surgery is performed, which stands for stapled transanal rectal resection. It is a minimally invasive surgical technique known for its safety and efficacy. STARR aims to correct rectocele, resect internal prolapse, restore anatomy, and correct rectal volume and function. More than 90% of our patients had a satisfactory surgical results in terms of faster recovery and getting back to their routine and work from the very next day. Healing Hands Clinic. Curing with care.